Hey everyone, it's Brandon Lee, host of the podcast Escaping Rock Bottom, season 3, and I've got a great guest back on the show tonight, Tyler Tisdale. He is the owner, the founder of Pinnacle Peak Recovery over in Scottsdale, Arizona. They're also part of my program, Art of Our Soul, where we teach art therapy to a lot of their residents who are inpatient. They also have IOP. It's a really great program here in Arizona. Tyler's back. Tyler, good to see you, my man.
Yeah, thanks for having me.
Okay, so last episode with you, we kind of got to know you, your story, kind of what led you up from scheming banks, which was hilarious to kind of even understand how you ended up here in Arizona. It's fascinating. But today I want to talk about kind of stuff that's happening around our society, especially here in Arizona. We'll start with the fentanyl, top of mind. That was major breaking news around the country. That was, I would even say, probably one of the biggest fentanyl busts ever. And it happened over in Scottsdale, Arizona. So a couple of things I want to talk about with this. It happened in Scottsdale. This did not go down in Maryvale. This happened in Scottsdale. So I want to talk about, kind of the area, the region, about where this happened, and also what does that do in the fight to save lives with so much fentanyl in pretty much every street drug out there. So first, your reaction to that major fentanyl bust.
Yeah, I mean, my reaction was I was relieved and excited because I know how many lives it's literally going to save. I've had countless of friends die from fentanyl overdoses, and it's just tragic.
And fentanyl's in everything, and I think that's important for people to understand too. Fentanyl isn't just a prescription bottle. Fentanyl is now in heroin. It is now in cocaine. It is in everything. So to think that maybe I'm going to go to do a little ecstasy this weekend, fentanyl's likely could be in it. Fentanyl is pretty much in it's even now found in marijuana.
Yeah, it could be. And they sell on Amazon test strips for powder and the liquid form of substances. So I definitely suggest, if you still are actively using, go buy those. They're cheap, and it's a safe way to, it's harm reduction. Yeah,
and we'll get into harm reduction today too, because fentanyl strips, as much as people push back against fentanyl strips, like that's not helping solve the drug problem. No, it's saving lives.
Yeah.
I'm a huge fan of harm reduction because not everyone's going to get sober. So if we're all about saving lives, people are going to use recreationally. Let's save them from death.
Definitely.
Back to the fentanyl bust. How many pills were seized? Was it like over 1 million, right?
It was a lot. Yeah, I don't know the exact amount.
1.7 million. It's insane.
I was surprised, yeah. And they're being pressed. They're made in Mexico. They're pressed in Mexico. They look like oxycodone 30s. They have an M with a square around it. And these kids in Scottsdale or wherever around the valley or wherever around the country, some of the kids, they're high schoolers, and they take the pill not even knowing like what it is. They just think it's a pharmaceutical and tragically die. So, I mean, it's a horrible thing.
I mean, there's the big campaign that's kind of going around right now, and it's called One Pill Can Kill. That's like the big push right now, is that whole campaign, One Pill Can Kill, because it certainly can. I interviewed a mother of a teenager, Isaiah, down in Maricopa, and her son took half of a pill, which they thought was like a Valium, or they thought was an Oxy, actually. They thought was an Oxy, and it had so much fentanyl in it, he died from that half pill. So yeah, one pill can kill, half a pill can kill.
Yeah.
Let's talk about this happening in Scottsdale, because when that news broke, I was happy, and I'll tell you why it happened in Scottsdale. Because that really starts a conversation with parents in Scottsdale talking to their kids about drug use. I fear that had that drug bust happen in a place like Maryvale, the folks in Scottsdale would be like, see, look at all this stuff that happens in Maryvale. No, it's happening in the richest zip codes in Arizona.
Yeah, absolutely. I mean, addiction doesn't discriminate, and these kids are partying, having fun, and like I said, some of them don't even know what it is, and they're taking it. It's just so tragic. But as far as like it happening in Scottsdale, wasn't totally surprised, but I'm in this. I'm immersed in recovery in the addiction field, so I know where it is, and it's everywhere.
Right. It is. How do parents, though, Tyler, how do parents even have that conversation? I go back and forth, with this all the time. It's like, yes, talk to your kids about drugs. However, it goes deeper than just that. And I challenged somebody who was big on, it's up to the parents. Parents got to talk to their kids about drugs. And my follow-up to her was, but what is that relationship like with parent and child?
Right.
Because if mom and dad are showing up to the dance recitals, they're showing up to the soccer games, they're showing up in their kids' lives, It's about the relationship that the parent has with that child. Like, do you have a good relationship with your child? Because my parents weren't always around. I grew up in Laguna Beach, California. My house was a party house, right? If my parents tried to tell me don't do drugs, guess what the F I'm going to go fucking do? Drugs. I'm going to go do drugs to spite my parents. Yeah. So just the whole thing of parents talk to your kids about drugs could actually backfire. If you don't have a great relationship with your child and child is already resenting you, you tell them not to go do something, they're going to go do it to explain. So how do we even bridge that gap, and how do we even have that conversation with our kids? Does it happen in high school? Should it happen in high school? Should it just be the parents' responsibility?
Yeah, I mean, it's a difficult question to answer because I think each case is specific. But for me personally, I have a 3.5-year-old and a 10-month-old, and I'm not looking forward to that day of having that conversation. In fact, just to be honest, like, I'm scared shitless with what's going on right now with them getting older and addiction running in my family. But what the conversation I would have with my kids is just explaining that 2 milligrams of fentanyl is considered a lethal dose, and the DEA tested out of all the pills they tested for fentanyl, 42% contained at least 2 milligrams of fentanyl, and that's just 2 grains of salt. So I would have that conversation with my kids, at least explaining that is like 2 grains of salt of fentanyl can kill you, and you don't know what it's in.
Yeah, God, this is so crazy, and it's all being produced where in Mexico, essentially, and then
and China, it's coming over from, but it's mainly those M pills are Mexico
are coming from Mexico. Yeah, because I mean, listen, I got to be honest with you, it scares the hell out of me, and I've been sober for a long time. Because here's the thing. It scares me for people who are sober because, listen, Tyler, the fact of the matter is relapse is part of a majority of our stories. It just is. And I don't care. I push back against old timers who come at me being like, it doesn't have to be part of your story. And I look at them back. It's a majority of our stories. So let's just accept that and get rid of the shame around relapse anyway. But my fear is this, is that people who are addicts and they relapse, if it's meth or heroin or anything like that, you go back right where you started. But guess what? If you've been sober a long time, like you and I have been sober a long time, those drugs are different than when we were hitting them over a decade ago.
Yeah.
And if we go back, like, that stuff can have fentanyl, and people will die on relapses more so, I think, now than ever before.
100%. Yeah, and not only that, but your tolerance is lower, and you go back to using the same amount that you used before, and it's a deadly cocktail.
Yeah.
I mean, and that's how most people die, is going back to it off a relapse. I don't know what the statistics are, but I've just known a lot.
Okay, I do want to talk to you about harm reduction because that kind of leads into this, and we're talking about fentanyl test strips. And being a former journalist, I covered a lot of these stories about harm reduction. As a matter of fact, it was my story back in 2018 when I trailed or shadowed, I should say, a shot in the dark, a needle exchange program here in the Valley. It was super popular at the time.
The owner of that is one of our therapists, by the way.
Really?
Yeah. Yep.
Okay, so it used to be illegal.
Yeah.
Right. That needle exchange program used to be illegal.
She's awesome.
Yeah. It's
great.
So badass.
Yeah.
So he was like in 2018, I shadowed Shot in the Dark. Now, mind you, they told me, Brandon, when I reached out to him, they said, no. We've had multiple journalists reach out to us, want to do a story about harm reduction because it's illegal what we're doing, We don't get really arrested for it. They're not really out there hunting us down, but it's illegal. And so, and they said, no. They're like, no, B, we've been approached so many times. We don't trust the media. And I'm like, I get it, but I'm you. And so I eventually convinced them. They're like, all right, you're sober. We know you're not going to burn us, and we'll know you'll do a fair job. So it was really cool because I got to see from start to finish how Shot in the Dark worked back in 2018 when harm reduction in Arizona was illegal. And so it was fascinating, dude, going to their shed where they had all the needles and the tourniquets and the cooking plates, Well, Bill Montgomery happened to be the Maricopa County attorney at the time. And I'm glad I'm an ex-journalist now because I can really share my thoughts and feelings. This dude thinks marijuana is the gateway to everything. And I'm like, dude, you're like that typical old school Republican thinking that marijuana is the gateway. Like so old school. And I'm sitting there. Now, mind you, he didn't do his homework on me. So he just thinks I'm some journalist asking him questions about this. He has no idea I'm a recovered addict back in 2018.
Oh, wow.
And so I'm just like looking at him and he goes, handing someone a needle and giving them a cooking plate is sending them to their graves faster. And I said, oh, really? I said, that's fascinating. I said, do you know what the rates are of Hep C and HIV being spread among IV users? And I said, do you know what that's doing? And he goes, well, we're just giving them a clean needle isn't going to save their life. And I'm like, wow. I'm like, do you actually think by keeping someone from access to a clean needle is going to get them sober? Because they don't have a clean needle. You talk to a heroin addict, Bill Montgomery. Listen, dirty needle, clean needle, they don't care. Needle's a needle. So we might as well give them a clean one. Stops the spread of HIV and Hep C, keeps them out of the hospital where they're driving up the cost of insurance rates, right? He didn't believe me. So I told this group, I said, listen, you want to change this law? They don't care about the hearts and minds of people. They care about money. So prove to them how many people are showing up to the hospitals with Hep C and having surgeries and needing all this medical care because of dirty needles. And it was just like a light bulb clicked on for some of these lawmakers to sit there and go, oh yeah, it is kind of driving up the cost of insurance. Maybe we should, do this. Then it got on fentanyl strips and people were like, why? More people are going to use drugs if we give them access to fentanyl strips. That's the logic of the anti-harm reduction. Well, why would we do that? It's just going to promote use. No, like the kids are going to go to raves. The reason why I'm so pro fentanyl strips right now is because, Tyler, people are going to go to EDM festivals. They're going to buy ecstasy from some rando person at this. If on price of admission, when they give them their ticket, they give you 2 fentanyl testing strips, I truly believe it can save lives from overdose. And I just want 100%. Your thoughts about everything I just said.
Oh, yeah. I mean, I'm in full support of it. Kim Boardman, the co-founder of Shot in the Dark, puts it really elegantly. It's people that are willing to get sober, they go to treatment, which is awesome. Like if you're willing to get help, go to treatment.
Yes.
But what about the people that aren't willing to get help? They need treatment too. And that's the treatment. It's just keeping them alive until they are ready. Because if you're dead, you can't get recovery. So it's about saving lives.
Right. Do you think that the thing I love when that harm reduction bill got passed here in Arizona is that now you can go get Narcan, right? I mean, listen, this is what we're fighting. We're fighting ignorance. People truly felt that like the general public thought, oh, why were you giving people Narcan? You're going to give away Narcan. They're going to get high off of it. I'm like, see, but this is what we're battling. Like if you're sitting here listening to this podcast and you actually think Narcan is going to get you high, like, shit, you're the reason why we need to educate. Like, okay, if you talk to a heroin user or a meth user and they have to administer Narcan, they're going to tell you it's the shittiest fucking feeling.
Yeah.
It's not pleasant and it's not getting them high. What I love about the fact is now you can go to your local pharmacy without a prescription, without explanation. You go, can I get Narcan? Whether it's a nasal spray or it's an injectable, whatever that is. I carry around 2 nasal kits in my car just because of the line of work that we do. You never know.
Yeah.
And what are your thoughts? What are your thoughts about that? I have seen proof that it is saving lives. Just access to Narcan for drug users is saving lives.
Yeah, no, it 100% is. And so there's a few harm reduction tips. It's have Narcan, never use alone. And if you are alone and you don't have someone to use with, there's actually a hotline that you could call. I don't know it off the top of my head, but I can give it to you and you could post it in the comment section. But you could call a hotline and actually use with them on the phone to make sure that you don't overdose. But as far as Narcan goes, I mean, I think it's crucial. If Narcan definitely saves lives, and if out of the 41,500 people that died this year so far of a fentanyl overdose had Narcan, that's a lot of lives that get saved. And like I said, I mean, you can't recover if you're dead. So just save lives until people are willing to get help.
Okay. I want to talk about the actual injection sites, safe injection sites. What was in New York City?
Yeah. Safe injection sites. And they're in Canada as well. So this was the first safe injection site that got passed legal in New York. There's a lot of controversy around it, but I mean, I'm definitely pro injection site, and I'll tell you why. Once again, it's just about saving lives because you can't recover if you're dead. So it's not. I think there's a lot of misinformation out there about safe injection sites. I mean, essentially what they are is you come in and you use in a bathroom or behind a closed door, and people just check on you every 3 minutes. And it's very rare that a person will come in there that has never used before. These are like, regular addicts that have been using. And there's also data behind it where people aren't migrating towards New York City because there's a safe injection site. Like, people aren't moving from Arizona like, hey, I got to go to New York because they have safe injection sites. That's not happening. It's really about just saving lives. And there's also pamphlets and information on how to get help to the people that are there. So it's really, you're getting in front of so many people in active addiction that don't know help's out there, and you're giving them pamphlets, you're giving them clean needles. It's a really cool thing.
Yeah, I think there was even, I think one of the first ones was like in the Philadelphia area.
Was it?
A couple of years ago, and that was real new, and it was just like community backlash to the nines. Because I'm a huge fan. And by the way, like, again, Tyler owns and operates an addiction recovery treatment center. One of by far the best in Arizona. And he gets people from around the country, because I ask people wherever they're from in my art classes, and they're like from San Diego. They're from like all over the country, and in New Mexico. I think there's somebody from New Mexico who's a girl from New Mexico who was in my art class the other day. And I say this because this is Tyler talking about harm reduction, and he's in the line of business of getting people sober. And it's important for people to understand, right? People aren't always ready to get sober at that time. And we have to, I always say, this is therapist talking to me because it's been told to me, I didn't come up with this. It's meeting people where they're at.
100%.
All right. You can't force somebody to meet you where you're at. Like, you have to meet them where they're at. And how can we keep you safe today? Okay, if you're not quite ready. Now, for example, I'm going to obviously not use his name. There is a friend of mine who reached out to me recently. Right? I may have noticed he may have a drinking problem. Am I going to call him out on it? No. But would that do anything for me? No. I'm going to wait. He obviously knows everything that I'm about, everything that I do, waiting for that call. Well, guess what? I finally got the call, right? And It was a tepid call. It was kind of like, I think I'm having a little bit problem drinking. I've tried like holding off for a few weeks, Now, mind you, I texted Tyler and I was like, here's Tyler's number. Text him. He'll hook you up with a real person, like whoever you need to. And guess what? He's going to go to IOP, which is fucking amazing, right? But it's meeting him where he's at. He was scared by residential treatment. Okay? And I knew that, which is why I told him, you don't have to go to residential. He had never touched the treatment world. Getting somebody just to admit to residential is sometimes a tough sell. So I said, fine. I said, hey, dude, you still get to go to work every day. Do IOP. Okay? You can still keep your job. You can sleep in your own bed. Do IOP. So we got him in the door through IOP. And hopefully that gets the ball rolling. And if he does need residential, we can move him to residential, right? So the reason why I say it is this is Tyler. He's in the line of business doing this, and he's pro harm reduction. I'm pro harm reduction too, because it is about meeting people where they're at. It is like, the statistics say it's like 23 million Americans are addicts. Okay, I think it's higher than that, but it is what it is. So it's just a statistic. But only 2 to 3 million will ever see an AA room. Okay, only 2 to 3 million will ever walk into a 12-step room. If we got 23 million Americans, 23 million addicts, we got to meet 20 million other people where they're at. All right, and the stigma. Okay, then we got to fight the stigma, because there's a reason why there's an outcry to this. I don't want that shit in my neighborhood. Okay, right.
That's
a
big
go
one.
It's always that fucking one. Whether it's a treatment center or a fucking sober living, or it's a treatment center where you have a house where you keep people. Oh, it's always never in my neighborhood. So if you're one of those people in the wealthy zip codes and like, not in my hood, go watch my Shot in the Dark expose. And I'm going to tell you what. Because out of 100 people, Tyler, who showed up to Shot in the Dark at the Fiesta Mall parking lot, vacant parking lot, okay, out of 100 people, 2 were homeless. 2. The rest of them, girls 18 to 45, were a high majority, showing up in a Mercedes, in a BMW, and a Range Rover. We have it all recorded. And the reason why I did that expose is because I want the wealthy parents in Scottsdale and Paradise Valley to watch this, to see that. Because guess what? These were girls in mommy and daddy's car showing up to get their needles. So it's your kids that we're talking about. So when we talk about safe injection sites, we're talking about keeping your kids sober or keeping your kids alive with the hopes that one day they get sober. What's your thoughts about that?
Well, I have to check it out. I haven't seen it.
Yeah,
and,
I'm going to send it to you. You can watch it. It's like an 8-minute expose.
Yeah, that's pretty powerful. And yeah, I mean, it is. Addiction doesn't discriminate. And I think a lot of people, when they think of a drug addict or an alcoholic, they think of the homeless guy.
They absolutely do.
With their hand out.
They absolutely do. It's not true.
We treat... we've treated thousands of people and helped thousands of families, and rarely is it that. It's like I said, it's the working professional or working professional's son that we see or daughter. And yeah, I think it's really important to keep them alive, keep them safe, and keep them clean without HIV or other diseases that you can get from dirty needles.
Right. And like I said, like my classes are never open to the public, but if the public had a chance, well, I do post pictures. So just look at the pictures, and you go to my Instagram and you see the pictures of the people who are at Art of Our Soul. You going to tell me they look homeless?
No,
they don't. Okay. Not at all. These people look like my friends.
Yeah.
Like they look like your coworkers and your colleagues. And these are people who have faced addiction and they're trying to get sober. So if you're out there thinking that these injection sites are only going to attract the homeless, is bullshit. If you think that it's only going to save the homeless lives, because trust me, it was after that expose, Tyler, is the first time I went public about being an addict. I had about 8 years sober at the time. I wasn't closeted being in recovery, but I was never on the news saying, hey, by the way, I'm a meth and heroin addict, a recovered addict. But it was that, and I'll tell you why. Because the comments under that fucking story I did.
Oh man.
Ruthless. All people here in Arizona. They saw that. And I was out there on the streets with these people, and they were like, oh dude, they're scum. They're trash. Let them fucking die. They're all homeless. And I was just like, yo, dude, I am so done. I am done with all these nasty comments. So that's when I just unloaded like 2 days fucking later. I was like, yo, that's me. I used to be that guy. Would have been that guy in that needle exchange, like looking for those drugs. Like, do you think that I should be dead? Like, do you think that I'm a piece of trash and I'm a piece of scum? Because that's what you just call all those people in my story.
I think I actually saw that, and I don't know.
Like, it
rings a bell.
It's insane. It was so disgusting, and it was really that was one of the things that, like, spending the day, like, it opened my eyes. Because I don't know if I would have been pro needle exchanges until I witnessed the people who showed up in that line. I mean, one was a kindergarten teacher who just gotten off work, and she went on camera, Tyler.
Wow, that's awesome.
To get needles, and she's just like, and her boyfriend died from Hep C from using a dirty needle, and like she just fit. And then there was a crane operator who just got done working a crane in downtown Phoenix, showing up there like. These weren't people showing up in a shopping cart looking for a clean needle. These were people who are in our everyday lives, doing that. So I'm glad we're touching on harm reduction. As we kind of begin to close, I want people to understand about meeting, since we kind of brought that up, meeting people where they're at with harm reduction. It's huge. But also meeting people where they're at when it comes to treatment and addiction. Because I want people to know that there are different levels. And if you're one of those people, because we're hitting the holidays, right? This podcast is going to air tomorrow. So, we're hitting the holidays. The holidays are not an easy time. It's why I'm open for Christmas. On that Saturday for the folks at Springboard. I get it. Like I told them, I was like, I'll be there open for you for Christmas because I know sometimes the holidays suck for addicts. You're around a lot of alcohol. You're around a lot of parties. Fuck, you know what? Not the good times. You're around your family for the fucking holidays, and that in and of itself can send an addict to use. Like, I get it. But meeting people where they're at is like, you don't have to always go to residential. There's other options. Like if what do you guys offer that isn't necessarily always residential, that somebody who may be an alcoholic kind of tiptoes into recovery?
Yeah, so I'll just go through the different levels of care and zoom past the inpatient levels of care. So there's detox and there's residential, and then we have day treatment, which is from 8:30 to 3:30. You could live at home, come to the center. That's typically 30 days. And then we also have IOP, which is 9 to noon, Monday through Friday. So that's a step down from day treatment. And then the step down from that is evening IOP, which is Monday, Tuesday, Thursday, 5:30 to 8:30 p.m. So like your friend, you could go to work and then show up after. And then that would be the levels of care for treatment. And then we have integrated care services, which is almost just like going to your doctor's office. A lot of addicts in early recovery don't have primary care physicians. So we're trying to change that with our Pinnacle Peak Integrated Care. We offer primary care services, outpatient psych services that treat depression, anxiety, bipolar disorder. And then we also do medication-assisted treatment and counseling, outpatient counseling. So the integrated care services, like I said, it's just like going to your doctor. You're in and out. We're really big on short wait times because I know that could be a real pain for doctors. And so that's really where we're meeting people where they're at, is when they call in and they're not willing to do any form of treatment. We also have those services that we could offer.
Nice. And then you have the residential that launches in March. We'll talk about this a few more times as we lead up to that.
Yeah, March or April, we have a 36-bed residential opening up in Scottsdale.
Nice.
Yep.
And you guys take insurance, right?
Yeah, we're in network with most insurance. And at the Integrated Care Clinic, we also take access.
Okay.
Yeah.
So before we close, one last thing. I've kind of jumped headfirst into the mental health world, and what I'm learning is that December and January can sometimes be a little quiet in the treatment world because of insurance and because of like deductibles and all those things. So like, I don't know, man. There's just something, I just wanted to bring that up because there's just something like we got to change in the insurance treatment world. Like, if you need to get sober this week, like it should be your check-in date. Like if you check in 20, like here's my thought. Like I want to get some lawmakers. Like I'm all about lobbying this.
Yeah.
Because if you check into treatment on December 25th, that should count as your deductible until you end treatment. Just because your insurance naturally resets January 1st.
Yeah.
If you check into treatment, I'm talking just for treatment. If you check into treatment in that, guess what? When January 1st hit, you shouldn't be kicking people out to the streets because they can't afford their $3,000 deductible. Like if you met your deductible all year and you go into treatment on December 23rd, well, guess what? Come January, that insurance companies will be like, give us more of our deductible back. And that prevents people
I
from
think
either
that's a great idea.
staying into treatment.
Yeah, no, that's a great idea. And not to mention December also with Christmas, it's a slow time. A lot of people don't want to send their loved ones away, or people don't want to go to treatment because, you have Christmas coming up. And then January can be a really busy month because of all the New Year's resolutions. And also that's where there's higher risks of overdose as well, because people do those New Year's resolutions. They get sober for a little while. Their tolerance goes down. They go back to using the same amount. And, it could be deadly. I just want to throw this out there before we end too, is last year, not just fentanyl, total drug overdoses were 93,000 people in 2020. And that's nearly double the amount of people that died from HIV at its peak in 1995. And so it's a lot of people that deserve to live. And, just because they have the disease of addiction, they deserve to be treated, and we want to meet them where they're at just to kind of keep them alive and get them sober down the road. So.
And now as an ex-journalist, I can sit there and go, you know what? More people are dying from fentanyl, way more than COVID. All right?
Yeah.
Like beyond more than COVID.
Yeah.
So, hey, news, cut it out. Like, I get it. COVID's here. Like, yeah, some people are dying from COVID, but like, look at the data from fentanyl overdoses and fentanyl deaths compared to COVID.
Between the ages of 18 and 45, the leading cause of death is not COVID, car accidents, guns, any of that. What it is, it's fentanyl. Yeah. It's literally fentanyl overdoses is the leading cause of death between 18 and 45.
And that's insane. And so to those people, to those super conservatives who do not want drug education taught in our public schools, like at what point, right? At what point are we just going to hit it hard, in our schools and offer counseling services and therapy services? Because I am still a believer that trauma is a gateway. Bullying, if you're being bullied at school, you want to fit in with a crowd, you're going to do drugs. Like that's where it fucking happens, and so we need that there. Tyler Tisdale is the owner and the founder of Pinnacle Peak Recovery. You've seen at the bottom of the screen how you can reach out for intake. Also the website to go to if you have any questions. Heck, one of my friends is going to be going into their IOP program. That's how much I believe in their program. I would not pimp out a program if I did not actually believe in the services that they do provide. So if I'm sending some of my friends there, it's legit. It's a great program, and I get to see their clients once a week come into our art therapy art therapy program. So it's pretty awesome. Tyler,
and they love it.
They do.
Yeah,
they do talk about it. I think your staff likes it too, because it's always between Mitch and Brandon. As a matter of fact, one of his staffers, Mitch, is always like texting me. He's like, "Hey man, what's that recipe that we're using for this kind of porn?" It's hilarious, like to seeing your staff here. Cool. Well, I'm glad that they like it. Glad that they have a good time. So, Tyler Tisdale, Pinnacle Peak Recovery. Always good to have you on, man.
Likewise. Thanks.
All right, we'll see you for the next episode.